Good morning, everyone. I think we're going to get started.
Welcome to America, home of 5% of the world's people and 25% of the world's prisoners.
A prison population, a total of about 2.3 million prisoners.
14% of all people in the U.S. with HIV pass through a correctional facility. A third of the people with hepatitis C in the United States pass through a correctional facility. And almost half of those with tuberculosis pass through a correctional facility.
So the majority of the inmate population is male and young male.
Within our provincial system, we have 26 adult correctional facilities. On any day, we have approximately 8,262 inmates.
If we look at our stats, Aboriginal people comprise 22.8% of the total incarcerated population. We are overrepresented in terms of Hep C, HIV, tuberculosis. We're also overrepresented in our youth. We tend to go in a lot younger and quicker.
17.6% of our inmates have hepatitis C. 2 to 4% are HIV positive and receiving treatment.
The number of patients is falling. Are there people in there who are simply not telling us? Yes, we think there are.
23.4% of our inmates are admitted with a mental health alert.
Significant numbers of people with psychotic illnesses like schizophrenia, schizoaffective disorder, major mood disorders, bipolar, depression, various anxiety disorders, including PTSD.
71% are diagnosed with substance abuse disorders.
And so we're looking at a shifting demographic within the prison, and these are an interesting group.
If you look at Ministry of Health funds over 800 separate institutions in the province of Ontario.
We have a needle exchange, primary care, counseling referrals. We have smoking cessation, acupuncture, and we do hepatitis C treatment. We have been referred to kind of as a one-stop shop.
St. Lawrence Valley Correctional and Treatment Centre is the only public-private facility that Correctional Services has in Ontario.
He says it's a correctional facility. I say it's a mental health facility, but we're actually both.
In intake, we offer them a program called Basic Healing, the Aboriginal Substance Abuse Program, or in Search Your Warrior program, and Aboriginal Family Violence. There's moderate and there is high intensity for every program that we have.
So we have on admission a reception awareness program. We have a peer education program. Condoms, dental dams, and bleach are available in the institutions.
We do provide methadone maintenance, and 7.13%, and every day that's over 500 inmates on methadone in our facilities, and Suboxone, again, less than 1%.
Our presentation is on a community reintegration pilot that began with the provincial correctional system in January of 2014. So we looked at 26 institutions that we have across the province, and what we discovered is that every single one of them does discharge planning differently.
So in a nutshell, Project START is about a bridging individuals from correctional facilities to the community. Because it has the data behind it, there's actually funding behind it.
So part of our mandate of this program was also to start changing the philosophy of who deserves to be released and changing it to who should we be keeping in.
This is a subject that's very difficult to talk about.
Family docs in the community don't want to look after drug addicts who've been in prison.
Housing is a nightmare.
Housing is huge.
We don't always know where the patient's going.
I may plan for someone to go to Toronto, have everything set up, and the day before they're released, they're told they're going to Hamilton.
You know, if I don't have a house to go lie down in and a place to feel secure, am I going to be worried about taking my HIV meds?
Healthcare tends to get compartmentalized in the prisons.
There's no integration at the level of service provision. In one service you hear you don't take meds, in another service here you take meds.
So when it's locked down, that means nobody moves. That means that any clinics that you had booked for the next day is not going to occur.
This is what I call in the system, you can't get there from here.
The thing that always puzzled me was if the inmates don't like child molesters, they don't respect rapists, why do they tolerate rape going on in prison?
The other barrier would be the stigma, of course.
The prisoners do not like going to see psychiatrists because that's a label.
Do you think it's possible that we could carve out an exception to the code of silence when it comes to sexual violence?
If you've ever been behind bars and had the door clang on your face, things like that make a lasting impression.
People always like to think of the worst
When you say prisoners, the first thing they think of is your Paul Bernardo or Russell Williams, and they think of inmates as monsters. And what I try and tell people is that they're just people. The vast majority will be released back into our communities. And frankly, from my own personal view, I would prefer to have someone come out of prison who's physically, mentally, emotionally well.
I will take an inmate with me to walk with me somewhere if I have to go far down the walk. And that's who I trust to take care of me. And he knows I trust him to take care of me.
And the nurses that do correctional health care are incredibly motivated, dedicated, extraordinarily oriented and passionate about what they do in terms of caring for this, the people that are incarcerated federally.
They do their own separate work with our elders in the system with ceremony. That's where they're introduced. And a lot of times, sometimes that will be the first time they're introduced to something like that. So we're really igniting a spirit in a lot of them that are coming into the system.
We talk to offenders and they'll tell you this is the best they've been, this is the best they've felt, this is the best hope they've had for discharge and for discharge planning and for release. And I think those stories are endless.
Actually went back to the very prison I was in 30 years ago and shot a short film in the very cell I was in. 8 days I owned that prison. This place didn't destroy me. They let me at the controls and I was flipping switches and the doors were opening and the vibration coming back, and thought, Tom Hanks, I made fire.
There's a lot of really good folks working in departments of corrections who are truly doing their best to provide good services. Healthcare have great intentions.
We're hoping with all the people in the room that have been here yesterday and today can help bridge those gaps that we're finding.